I would like to ask you, we can start by Bart, how COVID has impacted your business, what are the lessons learned, and what is your strategy for the new normal? Thank you so much.
Thank you. Yeah, very valid question, I think. So for us directly, I mean, we're a startup, we're small, we have 7 people. But for me, directly, it meant going back to the clinic and working out in intensive care. So the team already lost 1. And we're in R&D phase at the moment, so really taking in data. But we saw that basically our data providers were closing the doors and only doing predominantly one thing, and that's managing COVID. So we really had a bottleneck there. Basically, no one was communicating anymore, and no data was pouring out at that point in time. In a way, it also is an opportunity, and we'll probably talk about that as well. But for us now, what we see is actually that as we're looking to tackle complications in one of the major pathways in the hospital, we now see actually more attention to that. And surgeons, our primary end users, are really focused on that now. So we really see more enthusiasm from that side, but we also see that the normally long cycles actually get shorter. So a friend of mine who works with another startup said, well, I work with the NHS. Normally a sales cycle is like 14 months, and now all of a sudden it's 14 days. So I think that kind of also illustrates what is possible now as well.
Thank you. Lina, please.
Being part of crisis management of COVID in many of the governments around the region have actually taught us as a consultants the lesson that in crisis, everything is possible, and you need to be 24/7, definitely. What we are seeing today is we're seeing a combination of going back to basics. So asking, how many ICU beds do I have available in hospital X? Things that you assume by default that the answers are there, you'll be surprised in crisis situations, you're not able to identify them. Do we have enough supply in the pipeline? And do we have enough protective kits? Are we able to sustain if we lose 3 or 4 of our doctors to COVID? These are the questions that you assume all the systems you've implemented over the last years are there to answer. And you'll be surprised that these answers are not readily available. People will question these answers, and you have to be there as a consultant at the middle of this, going back to basic dashboarding, basic data analytics that helps the crisis management committees answer these questions in no time. So it's like, I need the answer in 12 hours, and you have to be there. So what it taught us is things will happen, you will not be prepared, and you have to be ready to answer with the best possible way, even if it's innovative, even if it's not 100% accurate. You will never answer it in the same way if you had the luxury of time. So there's huge lessons that we're learning today from this crisis across the board. And I'm happy to share some of them as we go forward as well.
Thank you so much.
So on digital tech, I think there's always a good side of crisis. And I think looking at the dependency today on virtual care, on virtual consultation, on remote patient monitoring, and I would say the agile development of mobile applications to track and trace patients or suspected cases have led me to believe that people can change fast. I mean, we are seeing now, as Frederick mentioned, the number of virtual consultation cases are not only rising, it's like 300% over 3 weeks. And you're seeing it. And people are now in the mood of thinking, how do I make this a reality? And how do I sustain virtual care? Do I really need to go for a medication refill? So do I need to visit my doctor if it's just a simple consultation? So what we gained out of this crisis is people were scared of infection going to the hospital. So they stayed at home and accepted the virtual care, which means a whole new way of thinking. You don't need to be in the hospital boundaries if you have to see a doctor or get an advice. What we're also seeing is that people have started trusting remote patient monitoring devices and have lived through it, and we're not seeing major issues with that. We're also seeing in the digital health aspects a huge transformation in the way the health operators, the hospitals, are now suddenly collaborating and sharing data without all the boundaries that we've been seeing between cities that are competing or governments that do not want to share. So everything is opened up suddenly, which now will put us on a huge data lake of everything that is available, not only to fix COVID, but also to take it to the future and focus on prevention, focus on new medication, focus on how do I get all this data to generate more intelligence using machine learning and other things to solve problems, to improve outcomes. So we're seeing huge impact in a positive way out of COVID and going forward as well. That's just a few of them.
Thank you so much.
Maybe I can build on that, Jose. So for me, I've seen three major trends, and Lina touched on a few. But really, the silver lining to the crisis to me is that the future will come earlier. Because suddenly things that we were thinking about became the only way to operate in the lockdown environment and so on. And I see these three things are actually quite easy to remember because the initials also read COVID. It's collaboration, virtualization, and digitalization, COVID. So on the collaboration, I think what I see very interesting is how different actors in healthcare came together to solve a human and healthcare challenge in COVID. And this is really one thing that I hope stays after the crisis. And at Novartis, we've formed relationships with Berkeley University, for example, with the chair of the Therapeutics Accelerator for COVID research, which is coordinated by the Bill and Melinda Gates Foundation. So collaboration has been a big thing. Virtualization, as you said, Lina, in terms of telehealth, remote monitoring. We had all of these capabilities, but it wasn't widely used. And suddenly people are realizing it works. In many pathologies, patients had to go to their hospitals to pick up their treatments or get treated. And during the crisis, we've seen a huge increase also in home delivery and home treatment. So virtualization of how we do healthcare, no longer having to go to centers. And then on digitization and data, I think the way we share data and information across multiple actors to improve patient pathways, I think is one thing that will stay there. In some of the pathologies we have, it takes patients 9 to 15 years to be properly diagnosed and referred to the right specialist. So the way we're going to leverage data to treat better and achieve better outcomes is also a thing will come. On top of all of the digital tools that we can use to involve the patient a lot better on patient-reported outcomes, developing digital biomarkers to help treating patients better and getting value for money when we use medical treatments.
So, as a physician, if I may, Jose,
of course,
I've seen a number of really good things. So I've seen, in a rather conservative industry, if I may say, I've seen my colleagues move from one side of the spectrum to the other side quite quickly and actually get convinced. So telemedicine and uptake was incredible. And after 15 years of pushing, there's been some great developments. But I think now we've seen with the data transfer, and I really appreciate the optimism of Lina. But what I do see is that there I think so. What we see, we've all experienced that in healthcare, almost anywhere in the world, we're experiencing this slow burning platform, and the urgency is getting clearer and clearer. People are in some European countries dying in the emergency room because simply we don't have the staff and a number of other things. So that has really become apparent during this crisis. What also has become apparent to me is that these pockets of platforms keeping their data, hoarding the data, and using that as a position, as a moat to competitors, and not being able to open up or not wanting to open up is still there for some. And these are predominantly the major firms like electronic health record vendors, and I won't name any names, but I'm aware that they've actually tried to stop some of that process going on. So what I've seen, though, is that governments have put a real effort in to open up legislation to allow to let that happen and clarify GDPR maybe a bit more, because I think there's a lot of emotion and not ration going on around GDPR if you're talking about Europe. So that I think there are still some challenges there. I think we can expect governments to push a bit more maybe and oblige opening up APIs and a number of other structures to allow that data to actually exchange hand and make it a lot more or a lot better. Yeah.
Just from my side, Jose, of course, data is the core of any digital environment. You cannot have artificial intelligence, you cannot have predictive models, you cannot have proper capacity planning, which was key for the COVID vaccination across countries, without having the right data in place. And what we've seen, if you remember when I started talking, I was talking about people assume that the data is accurate, assume that they have enough stock of PPE. But on the ground, it was completely different. And that's something I think many people have learned the lesson of their life, like don't assume data is accurate. So data accuracy, data cleaning, having the right, what we call information architecture is key for any analytics or AI. So it's very simple. There is no artificial intelligence without information architecture. So there is no AI without IA. And information architecture, I think, is weak in many, many areas across healthcare. So one of them is the healthcare record, but there are many other areas where we've seen today failures on the supply chain, failures in other domains of healthcare, just because of the assumption that the data was complete, was accurate, was standardized, was exchanged. And I think there will be a lot of effort needed to standardize, cleans, like Bart mentioned, bring them all to the same level. Let us have the same measure system across all the labs in the city, so we know what to do. Let us have the same definition of diabetes level when we need it. So there is a lot of work that will need to be done to avoid having issues with data and actually use all these new technologies and emerging tech in AI, emerging tech in machine learning, and bring them to reality. So it's your first building block. So whoever asked the question, asked the right question. It is where we start.
Very good point. And actually, there's a lot of legal. Please, Ferry.
Yeah, and if I can build from a different angle, and I do think that the crisis will allow us to start joining forces across stakeholders to create the standards that Bart was talking about. But I think what's interesting also in the pandemic is that suddenly the accuracy of the data has become standard stage. And so if you look at even the difficulties we had tracking disease progression during the last few weeks, and then how numbers changed. I mean, just amazing that we're in this situation. And so even if I look at from the clinical side of things, I'm not sure you know, but there's over 7,000 scientific papers that have been published on COVID over the last 8 weeks. Just amazing the volume of data that is being gathered and published. And so it's very difficult to get our way through this. And I'm glad actually that the challenges of dealing with data take center stage, because ultimately the outcome of all of the things that were described by Bart and Lina and the challenges we have there is that we have patients that don't get the right diagnosis, that have patients that use treatments that they shouldn't be using, that consume healthcare resources they shouldn't be consuming, and ultimately that don't get the healthcare outcome that they should be getting. And I think, therefore, it's critical, and I hope that's the one thing that we start joining forces on.
Do you think that technology companies will expand to healthcare? Because we know Google has announced, Apple has announced, Microsoft, IBM, all these top companies are now doing some. Amazon, by the way. So what do you think? Do you see that as a threat? Is the ecosystem is evolving like many others? So if you could give some insights on that, please.
I'll go first. I think they are already.
Yes.
Yeah.
I think they are already.
Could you give an example in your area?
Well, I think from our perspective, we're already working with Microsoft, for example, on the use of AI. We're collaborating with Amazon also. So we have already in our own ecosystem, we're already working with major technology firms, but then with many, many startups. We have a structure called Biome, where we collaborate with startups in a number of countries, including my home country here in Spain. And ultimately, what's good about it is that we join forces to solve human and healthcare challenges. They do things that a pharmaceutical firm is not designed to do. What we want to do at Novartis is innovate around the treatments that we're able to put in the market to reimagine how we solve these healthcare issues. And we need the collaboration of startups and public sector, etc., to be able to do it.
So what we're seeing the right convergence. So as Frederick said, Novartis with Microsoft could come to us something useful. It will accelerate the drug discovery. If you think other companies, Amazon, IBM, are doing the same partnership for specific disease prevalence, for understanding population health, for going into cancer treatment. So you need the two to work together. But I don't believe an IT company gonna become a healthcare provider on their own. They can try, they can provide the platform, but they will never be able to gain the trust of the population.
Good. As you say, I think all of you said before, there's a lot of opportunities. So let's see that as opportunities, not as complaints, because the future brings a lot of opportunities. I would like to conclude with a final question, because someone from the audience is asking if your companies plan to hire people in the next coming months. So I would like you, if you ask, reply to that. But also my last question is, what will be your career advice for people who want to pursue a career in health? So please, who wants to start? Frederick, do you have jobs?
Yeah. I can go. So I think a message for everybody that is looking to enter into their professional career now. And I'll start with actually a sentence that I love around technology and healthcare. And it's a sentence that goes like this. It says, physicians will not be replaced by artificial intelligence, and you can replace artificial intelligence by any technology. But physicians who use artificial intelligence will replace those who don't. And if you think about it today, physicians spend an average of, in primary care, 7 minutes with their patients, usually looking at a screen, behind the screen typing. And I'm sure that apart from improving quality, technology and digital will humanize more the process. Well-being and healthcare is, to me, together with environmental sustainability that Lina mentioned with the less kilometers, the biggest human challenge that we have, that we're confronted with. And I was reminded by the organizers of this event that actually digital was, for me, an acquired capability. For you guys, it's your native digital, right? And the future of healthcare, to me, one of the big fixes will be digital, and you are the generation that needs to make that happen. The 2019 flu, the so-called Spanish flu, led to a major strengthening, in particular in Europe, of the healthcare systems. My hope is that the COVID crisis will lead to a major strengthening of healthcare systems through digital. And I hope this generation is the one that makes it happen.
Good. Talk about the young generation. Bart.
Well, thank you. I think that's too much honor, but I'll take
all
that.
All of us, we are young generation.
Maybe in my mind, yeah. No, so we just hired 2 people, and we're going through a financing round within the next 3 to 6 months. So we'll hopefully hire another 12 people after that. So yes, I think this is in a way, it's a critical period. It's a high risk period, but it also brings great opportunities. So the answer to that would be yes. How do we take it up from there? I don't know. I think we're really seeing more uptick. We're actually, I think the sustainability issue is something I see in the hospital now as well. So that's really interesting that's now being taken up. We're focusing on that as well. AI is actually, in a way, these big neural networks take up a lot of energy to actually build. So we're focusing on that as well. So we're working with the University of Bolzano to actually simplify our models to make them run quicker at the convenience of the end user, but also reducing our CO2 footprint. We had some extensive discussions even with Amazon. That's a big issue as well. So and then of course all the challenges that we discussed already. That's all in our way, and we'll happily have a bite at that.
Lena, please, with your all expertise and young experience, please tell us.
Honestly, if I tell you that during this period, I have seen a major requirements coming from clients for consultants who understand the combination of health and digital. We're completely sold out as PricewaterhouseCoopers in this domain. And what we're seeing more and more focus on the intersection of understanding data and understanding digital health. So it's not even a generic healthcare, and it's not an IT. It's that intersection that makes a difference. And if I find people who understand healthcare, who's willing to go into the data analytics or are interested in research or in additional machine learning expertise, that combination is the future for me. And it might apply at the hospital level, at an insurance company, at the government, because there is a huge need now for more and more research skills for predicting the future, for eliminating some of the diseases, for managing chronic patients, and technology is the norm. So my advice and the way we're looking at people to be hired are the people who are at that intersection or have one of them and willing to expand and digitally upskill their knowledge to come to this domain. And of course, they need to be open for surprises, open for being in one country and getting locked down during this period. So we will need also these people who like to be adventurous by nature.
So Frederick, Bart, Lina, any final remark about what you think is missing?
I think we were pretty complete.
Yes, please.
Awesome panel.
Well, first of all, thank you so much for this inspiring panel. I really love it that you share not only your experience, I think you provide the right motivation for people to understand that this new reality has a lot of opportunities. You are the example, so I think we should keep a positive thinking and say, yes, there's some constraints, there's some challenges, but the positive side is all of you are an example of the future is here. I love it what you just said, Frederick, about the future is not tomorrow. No, probably not, even probably not now. Probably we should start thinking yesterday about what's going to be the new reality.